I'm Steve Ryder. I'm a hepatologist, a liver doctor based in Nottingham, and I've been a liver specialist now here for 25 years. Liver disease is something that develops very silently in the background in someone who may feel perfectly well still at the time. If people drink more than their safe drinking limits, it causes a build-up of fat in their liver. And that's the first sign of injury, and that injury heals with scarring. And it's a gradual build-up of scarring in the liver that in the end causes the liver to fail. If the liver fails, it has a whole series of knock-ons in terms of other systems not working properly. And of course the biggest problem with your liver is it doesn't give you any warning. Quite a lot of people end up with long hospital stays, and quite a lot of people die before their liver has a chance to recover. So for me, trying to diagnose liver disease earlier is a really critical thing. We now have technologies that can tell you, even if you don't have any symptoms, whether you have developed or are developing a problem in your liver. And I think knowing if you're going to suffer any physical consequences might help make with some of those decisions. Do I go home and continue to take lots of alcohol, or does this focus my mind that I don't want to develop some of those physical health problems from it? For me, it's trying to use the medical bit in a way to balance those other issues. People drink for a reason, and it's an addictive substance. Lots of people run into trouble with it. Probably the best ways of providing a diagnosis for people now related to the liver is a fibro scan, is a test where we actually measure whether the liver's had any permanent damage or scarring done to it. People get a number, there's a reading that appears on the device, and we know that the higher the number, the more damage there is in the liver, so it's a pretty simple score. I think where we can help is both providing that technology and interpreting it. So saying to people, if you've got a normal liver, that's fantastic. If you are able to get on top of the alcohol side of things, that means you'll never suffer a liver problem. It's a really positive thing for people to focus on. I think at the other end of the scale, if people already have a badly scarred liver, the urgency with which they and we need to take it just goes up very significantly. Scarring in the liver as a result of previous damage tends to stay there. So it isn't as if the clock's set to zero again. If people stop drinking, they've still got that scar tissue. But there's also the ongoing damage from alcohol in the liver, and that's completely recoverable. So if there's no more alcohol going in, there's no more injury in the liver. It's not just about giving people a number. It's about trying to support people in making those choices about their life to preserve both their life and their quality of life, really.